Hello, my name is Sinead Liston. I work in the faculty office in the Education Health Sciences at the University of Limerick. Welcome to today's webinar for the Master of Science in Infection Prevention and Control Leadership. I'm joined by my colleague, Dr. Anne-Marie Bright, who's the course director for the programme, Lisa Leahy, who works in the School of Nursing and Midwifery, and my colleague Lynn O'Doherty, who also works in the faculty office with myself. Just a bit of housekeeping, please note that the cameras and mics are disabled for attendees and any questions can be submitted via the chat. This webinar is being recorded as well and will be shared with anyone who couldn't make it today. So I'm going to pass over to Anne-Marie for the presentation on this programme. Thanks, Anne-Marie.
Good afternoon, everybody, and welcome to our webinar on the MSc Infection Prevention and Control Leadership. Next slide, please, Lisa. Thank you. So just a very quick overview of the programme itself. The MSc Infection Prevention and Control Leadership is actually a Level 9 major award. It is a taught master's programme that is designed with professionals that are working in mind. As a result of that, it is offered on a blended format and it is quite flexible in how we approach the studies incorporated into this programme. And our next intake is September 2026. All applications are made to the MSc programme, yet there is the option for anybody who's on the programme to exit after year one, provided they have achieved the required credits with a postgraduate diploma. So we often get queries around this. So all of the applications are made to the MSc programme, but there is always the option to exit after year one with the postgraduate diploma in infection prevention and control leadership. Thanks, Lisa. Next slide. Thank you. So I'm just going to go through now the entry requirements that we have for this programme. Applicants must hold a health-related professional qualification at Level 8, NFQ Level 8, with a minimum of a 2-2 award or an approved equivalent. For anybody that might have a health-related professional qualification that is actually not a 2-2, it's below a 2-2, or if they have a different qualification, for example, you might be a nurse working in a different country and are now registered with the NMBI, however, that you don't meet these entry requirements, you are welcome to make applications using the RPL process, and all of the information on how to, avail of the RPL process is available to you on our website, and you can get some support with that through graduate and professional studies as well. You must also hold professional registration with your relevant regulatory professional body. So for nurses that are applying, that's a current registration with the Nursing and Midwifery Board of Ireland. It might be CORU, etc. For other health-related disciplines. Thanks, Lisa. Overall, the programme aims to support students to develop leadership, governance and clinical decision-making skills required to respond to the evolving public health challenges that we face in these times. Our graduates will be prepared to champion infection prevention and control practice and contribute to innovation and quality improvement in complex healthcare environments. Thanks, Lisa. Just to give you an overview of the programme is offered over 2 years. Year one consists of basically modular study, where in the autumn semester, which runs from September through to December, you will study health research methods, infection prevention and control in healthcare, principles of primary and community care. And then in the spring semester, which runs from January to April or just early May, you will look at promoting quality and safety in healthcare, leading and managing infection prevention and control, and health promotion in healthcare practice. Any of our modules on the programme with an M next to them on that table are also available to be taken as micro-credentials or university certificates of study. You can take those independently from the programme just to see whether or not this is something that you might like, or it might be something that you want to do independent of the programme. You can also take up to 2 microcredits from one programme and then use that to put towards a major award. However, you can only take a maximum of 2 microcredits before you are required to enroll on the programme itself. So once year one is complete, you move it. You can either choose to exit at that point with your postgraduate diploma, or you can continue on into year two, where you will, in the autumn semester, complete dissertation 1, and the spring semester, which is dissertation 2. These modules are linked. And what that is this one dissertation project for your MSc. At the moment, we have students completing an evidence synthesis. Thanks, Lisa. So I'm just going to give you now a little overview of the learning outcomes for the program-specific modules. So in the autumn semester, you have NS 6302, which is Infection Prevention and Control in Healthcare. And the learning outcomes for this module are to help the student to determine the impact of infection prevention and control practices in the management of healthcare-associated infections. You will learn to apply skillful infection prevention and control practices in accordance with national and international evidence-based guidelines. You will also learn to apply research-based approaches to infection prevention and control interventions, to analyse approaches to evidence-based practice, surveillance and audit, and to argue the value of a multidisciplinary team approach in managing infection prevention and control. In the spring semester, then, you will do NS 6192, which is Leading and Managing Infection Prevention and Control. And the learning outcomes for that are where you will develop infection prevention and control management and leadership capabilities at individual and organizational level. You will learn to critically discuss the core competencies required for infection prevention and control leaders. Also to critically appraise contrasting approaches to infection prevention and control management strategies. You will learn to skillfully apply microbiological and epidemiological knowledge to managing infection prevention and control strategies, engage in person-centered, evidence-based, safe and effective approaches to infection prevention and control practice management. You'll also be able to discuss the value of the multidisciplinary team approach to infection prevention and control management, and to demonstrate an appreciation of the importance of holistic and person-centered approaches to promoting and enabling safe infection prevention and control practices, and articulate an appreciation for training required to provide safe, effective infection prevention and control practices. And all of these learning outcomes are achieved within classes, and because it's multidisciplinary in nature, you're learning with and from people in other disciplines as well. Here is just an overview of the on-campus days. So our requirement is 6 on-campus days per semester. So this will just give you an overview of the autumn semester for academic year 2026-2027, starting week 1 on Tuesday, the 8th of September. And 6 on-campus days, then the final one being Tuesday, the 24th of November. It's always a Tuesday, so that helps those who are working professionally to be able to plan their off-duty lists and to be able to work, I suppose, with their managers in facilitating study days, etc. The online activities and assignment days is your blended weeks, where each module leader will assign you some directed study for the week. That directed study will have to be completed usually in your own time, as and when you can manage it within the week, and all you have to do is, kind of work towards whatever deadlines each individual module leader provides you. So there's 3 per semester. Thanks a million, Lisa. Next slide. Thank you. Some of the key features then for the program, and so again, I have spoken about the fact that this is a blended program. It offers on-campus and off-campus learning. So we have 6 on-campus days per semester, scheduled for Tuesdays only. The schedule of lectures that I had on the previous slide is available for the entire academic year. That's available online. Online, you will also find a full overview of the program with the module overviews, the program overviews, entry requirements, and any related fees. For those who are working for HSE or HSE funded organisations, you're advised to speak to your Nurse Practice Development Coordinator, your CNME or NMPDU unit, which will advise on continuing professional development and for funding. And those who are working for private organisations, you're just advised to speak to your line manager or for whoever is responsible for funding in your organisation. And if and when you decide to apply for the program, if you visit the module or the program website and click how to apply, the instructions will be there for anybody. So thanks, Lisa. Next slide, please. We don't seem to have any questions in the chat, so we'll just jump to the last slide there, Lisa, please. For anybody that might have any further queries, you can direct them to nm@ul.ie, and we will come back to you as soon as we can. Thank you.